I usually tell people a midwife means with women, like that's what the actual term means. So what our whole point of being there for you is to be there for you. So my point is to take care of you, educate you, do everything I can to prepare you for what's the next step. And the next step being the delivery. And then in the delivery process, taking you to that next step, which is the postpartum process. That next step is, into that. So I usually say, the midwife is going to have a little bit more of a holistic, natural approach.
Hello, everyone. I'm Dr. Chris, and welcome to another episode of Becoming Elite Podcast, a podcast created to interview some of the most elite individuals amongst our society. Today, we have Kassie Reil, my sister, who is a certified nurse midwife, right?
Yes,
And
that's
then
right.
also has her master and bachelor's in the science of nursing. A lot of schooling.
Lots of schooling.
Yeah. Uh,
Feels like forever.
we'll dive into how she became a midwife, kind of her journey starting there, and then kind of follow up with the chiropractic side with midwifery, right?
Midwifery.
Midwifery. It's gonna say it different every time.
Every time.
But you started after in high school. Did you know you
Hmm.
wanted to be a nurse, let alone
Um,
be a midwife?
no. So actually, I think it was like junior year. You took the class where you had to
Junior year of
follow
high school?
someone. Yeah, sorry, junior year of high school, you had to follow someone, and our aunt is a respiratory therapist, and I went and followed her. And I really didn't have a path of what I wanted to do. I really liked style and clothes, so I was like, what am I going to do with that? She was like, the best thing to do is go in and be a nurse. I was like, what? So that was kind of like my push to like look into nursing school. So that I looked more into it, and I liked actually the pediatric side of nursing at first. So I went to the University of Iowa for a couple years, and then I actually transferred to a school in Des Moines, Grandview University, which is where I got my nursing degree. I still was like on that pediatric route. I volunteered at the PICU in Iowa. I was still like, I want to stay in that peds. Our first day of OB rotation in nursing school, I saw a delivery and I was like, nope, this is for me. This is what I want to do. I really liked it. I liked it
And
way
that,
better than my peds rotation.
yeah, and that was at Grandview.
Yeah, that was at Grandview. So I saw
Okay.
it at a hospital in Des Moines, actually. And I really liked it, just was different. I loved it. I just knew right there that was my niche. So after I graduated from Grandview with my nursing degree, actually Unity Point in Des Moines, they have a residency program, so it makes it a little bit easier to get into a specialty when it comes to nursing. So a lot of times back in the day, you used to go straight into med surge, and then you had to like work your way into specialties. But I was able to get into labor and delivery right away. So I started as a little baby nurse, labor and delivery, and I worked over at Methodist West in Des Moines. So I had a little bit lower risk population. We actually at Methodist West do LDRP, and what that means is labor, delivery, recovery and postpartum. So I was actually doing the labor part, recovery. We'd help them out with postpartum, and I'd actually do like nursery and newborn care too, and also as a charge nurse, so I triaged a lot of patients. So you kind of had that well-rounded of doing everything as a nurse at Methodist West, which was really nice.
Yeah, and Methodist West is a really nice hospital. I think
Yeah.
it's not utilized as much as people really think they should. They like to go downtown, and we'll kind of discuss
Hmm.
that a little later, the difference between the downtown peds
The
with blank
hospitals, yeah.
children, and then you got
Yep.
Methodist West, which is an outstanding hospital that you were
Hmm.
at. When you were at Iowa, you were trying to do nursing though, right? Like that was your
Yes.
plan to go through nursing there?
That was my plan all along, was to go through nursing. If anyone knows about the University of Iowa nursing program, it's really hard to get into. My freshman year was, you basically had like thousands of people for 30 spots. My sophomore year, it was a little bit easier to hopefully get into, and I really worked towards my GPA to do it, but they changed their program. So it made it harder. I had to have 4 years of a foreign language, and I only had three in high school. And by the time I found out, I was too late to get that like semester's worth of foreign language. So that's why I chose to transfer.
Yeah, absolutely. And then you chose Grandview, which is kind of in the
Hmm.
heart of Des Moines here.
Yep.
What was the reason of joining Grandview? Was that moving closer to home since I know where you live? Uh, or or is it the school, the aspects? I know you did some cheerleading or dancing, not cheerleading, different subject. You joined the dance team. Was that kind of a
Yes.
factor with that as well?
That was honestly my indecision with everything. So transferring schools, I looked into Mount Mercy and Cedar Rapids. I thought about staying in Iowa City, and then since I had friends there, and then living in Iowa City and going to school in Cedar Rapids. But then when I got on the dance team at Grandview, that was kind of my ticket to like, okay, I can meet people this way, which I still have millions of friends from. I can meet people this way. I'm on a sport, and then I can also get my nursing degree, and it's closer to home. So yeah, it's only about an hour from our hometown. So I was able to have that aspect of it too, versus living in Iowa City, which was nice.
Yeah, because you graduated from Grandview
2015. So because
2015.
I transferred, I had to do 3 years, and I did 2 years at Iowa. So yeah, 5 years of your bachelor's.
Yeah, absolutely. And then from there, you were at Methodist West, right? With
Yep.
Unity
So
Point.
Yep. So as soon as I graduated, I got a job at Methodist West. I started in July. I worked there for
You were there
almost
a
five
while.
years. Yeah, almost 5 years. So I left. So I started July of 2015, and I left Methodist West February of 2020, which was crazy. Yeah, I can't believe it was
Yeah,
that long. But
yeah,
I watched Methodist West grow, which was really nice. Which kind of leads me into where I started, like my midwife, like
yeah,
route
absolutely.
of everything. Um,
Definitely go into that a
I
little bit of kind
Yeah,
of where you started to hear about midwives, but also how that kind of tied you into, hey, this is where I want to go do.
wanted to go. I knew I wanted to potentially in the future go back to be a nurse practitioner. Being in the labor and delivery route, I started looking more into women's health nurse practitioner. But I knew that was just clinic, and I know I am not meant to work Monday through Friday, 8 to 5. I'm not supposed to be an office job girl. It's just was never my thing. I worked nights as a nurse, so um, actually, so the more and more I worked, we had lower risk patients at Methodist West, so it kind of gave me an insight of what midwives, like the patient clientele they actually work with. Um, what really pushed me into being a midwife and knowing that I wanted to deliver is I actually delivered one of my coworkers' babies accidentally because the doctor was on her way back, and it happened so fast that it was just like, oh, here we are. And it was so that she didn't have an epidural. Everything was just very low risk. It was silent. It was literally her husband, me, and one other nurse in there. It was really nice. And I was like the provider at the time. And so it just felt really good. And that's how I knew I was like, I think I'm going to look into this. And I looked into schooling, and that's kind of where it pushed me to look more into schools and actually go back to school.
Yeah, because how many midwives are with Unity Point Methodist West? I guess not now,
So
but when you were there.
when I was at Methodist West, we didn't have the midwives. It was just the doctors. It took them a little bit. So the midwives used to only deliver downtown. That's because the doctor that they worked for or who was above them, that's where their contract was.
Okay.
Now, I believe since I've left, I believe the midwives have started working out there. I think it was a couple years after I left. So I think they've been out there for a couple years. They're trying to push their clientele a little bit more out there. I want to say there's five of them.
Yeah.
Five or
Okay.
I think there's five of them.
That's
Yeah.
pretty good because when you were at Unity Point Methodist West, like there was only half the hospital was only segmented out, right? And
Yeah.
then
When I
they
was
took over
leaving
the
is when it
they
was
took over
all,
the
yeah.
entire floor now, right?
Yeah.
So they have
When I was leaving, it was starting to all open up on both sides, which was nice
yeah.
because we were delivering. I don't know how much, I know they still deliver a lot now, but when I started working at Methodist West, we were delivering anywhere from 30 patients to like 60 patients a month. And when I was leaving, we were delivering like 120.
Yeah.
So that's a lot in difference per
Yeah,
month. This is
absolutely.
per month. Yeah.
And I guess kind of quickly here go into with the two hospitals in Des Moines area. So you get
Hmm.
Blank's Children's Hospital downtown Des Moines, which a lot of people go to because they're always
Hmm.
worried about complications with
NICU and
pregnancies.
stuff like that.
Because I
Yeah, for
mean,
sure.
it's a very major trauma going through a pregnancy versus going out to Methodist West. What would you advise people? Would you say, hey, yeah, go to blank or stay out at Methodist West if you have a chance? Or is it based on doctors or your staff like a midwife?
A lot of people like the NICU as just a back pocket just to be safe. Do I think that's okay? I think so. If you have a very low risk pregnancy, which I know Methodist West is getting a little bit more moderate to higher risk patients now that they've changed things. But if you have a low risk pregnancy, the odds of you needing that NICU are very slim. The one thing about Methodist West that we had was a neonatal nurse practitioner that came to every, about like newborns, deliveries, and all that good stuff. So I say, go with your gut and how you feel. But if you have a really low risk pregnancy, don't feel like the NICU is going to be your first option. Those nurses can take pretty good care of you and your baby. Even if there is something that they need to do a little bit, they can take good care.
And I know I asked you questions before, like text you questions for friends, but like
Mhm.
a lot of people get worried with that whole natural birth versus like having a C-section and thinking
Mhm.
that it's more emergency to style being a C-section out at Methodist
Mhm.
West. So they try to go downtown, but Methodist West can do all that,
Oh yeah,
all that
there's
stuff.
they have two OR. We have one at the time, but they were supposed to be getting a second. But there's an OR. I will say in my 5 years there, we never had an issue with needing both ORs at the same time. And they're very well equipped. I've been in a labor and delivery room and back in that OR within 5 minutes, and you're gonna get the same thing downtown. So
Yeah, absolutely.
yeah,
Probably a little less chaotic being out at Methodist West too.
yes. People
Yeah.
called us the Hilton of like the hospitals, if that tells you anything about it, when it
It's
first
a
opened.
it's a very nice hospital out on the west side of Des Moines versus
It
being
is.
downtown and being with traffic and stuff.
Yeah, it's
So
nice.
you did your residency at
Method,
and
or
then
I did
work
it at Unity Point and worked there.
and then
Yeah.
worked there for 5 years.
Mhm.
Decided that you wanted to go into midwifery.
Yeah,
Got
you
it
got it.
right. Going into midwifery, what were like choosing schools, where to go?
Mhm.
What was that all look like?
So I actually went into school to be a midwife around like 2.5 years of being a nurse. So um, it took 2 and 2.5 years to get it. But so when I was looking at schools, I kind of just did a little Google search, like midwife schools, like whatever, certified nurse midwife schools around like the states. And most midwife schools are all virtual and then or online, and then you go in for like skills and stuff like that. There are a couple that are very popular when people think about becoming a midwife. That would be Georgetown and Frontier. I actually looked into one in Minnesota, and I can't even remember the name now, and the University of Cincinnati. Uh, Reason why I ended up going with the University of Cincinnati. Reason being is they did a lot of their clinical work while you were still in school. Some of the schools did all of your book work, schoolwork, and then you did your clinics. Um, the way I learn, I just knew the way I learn, the style I learn is to learn while I'm also hands-on because I can correlate the two together, which helped me in the end of, I think, and me personally, everyone else is different. But so in school, I did part-time so I could still work full time up until the end. Um, but in school, you get a midwife, you get a preceptor. I was able to do that in Des Moines, all my classes were online. And then I actually went out to Cincinnati, I think twice, to do like skills checkoffs, and like you got to meet all of your like your classmates and all that stuff too.
Nice, nice. And how long was school at Cincinnati?
If I were full time, it would have been 2 years. Part time, it was 2.5. So I
Okay.
started May of 2017, and I graduated December of 2019. So it feels like it goes by really fast.
Yeah, absolutely. Then you hit graduation, so become that
Hmm.
certified nurse midwife. And
Yep.
then what was your plans after that? I know looking at different places, staying in Iowa, but what ended up happening?
Yes. So when I graduated, there wasn't really any jobs in Des Moines. So it was really hard for me to be like, what do I want to do? After you graduate with your master's as a midwife, you still have to take boards like you do for nursing. So I did have to sit for my boards. We all know what went into 2020. So by the time I was able to take my boards, I had to retake them again. I wasn't able to retake them for like another 4 or 5 months because everything was shut down. So I actually didn't even pass my boards until June of 2020. So I worked as a travel nurse first. Reason being, it kind of helped me transition to where I wanted to go. So since there wasn't any jobs in Iowa, I started looking at states, like different states, kind of looking around. I said to myself, if I was going to move, I was going to make it worth it. So, which led me to being in Arizona now for almost 4 years, which is insane. When I was looking into travel nursing, I was like, let's go. I was talking to a job down here already for a midwife. I was like, let's take a travel assignment down to Arizona, see if I even like living there first, and we'll go from there. And that's exactly what I did. Then I passed my board, so I worked as a travel nurse down here, which it's crazy to think like between states how different your style of care is, but it's very different. So it actually helped me, I feel like, pass my boards because I was able to see two different sides of how people care, the way you use like your systems, like, oh, you use inches versus centimeters. I know that doesn't sound like a lot like different, but like in your mind, when you're taking your boards, if that's what they have on there, that's what you're gonna look at. Um, the way they like use like the meds that they use, their first line, all that thing it was all different. So I got a job down here and I started that in April of 2020 as a midwife, my first job.
Okay. And then I know you've had a couple jobs since then, but you finally landed
Mm-hmm.
in the spot that you really like. Kind of give us
Yes.
a description of that place, why it's different, and kind of the way you practice and really enjoy it now.
I will say, leading into being a midwife, I didn't realize how hard it was to find that like midwifery model. So when someone talks about being a midwife, they want it to be a little bit more holistic, natural approach. It doesn't mean that you have to have like a natural birth. Most midwives deliver in a hospital, which I'll get more into that. So you can have an epidural, do those things, but we live in a world down here in the city. There's a lot of higher risk patients, and we're losing doctors. So midwives are kind of like that middleman of they can take care of these patients and deliver these patients. So you doctors are taking these midwives and using them. So the difference that I've seen between the jobs that I've had and this job is that it's way more focused on the midwife model. So a lot of the jobs that I had, it was patient in, patient out, like as fast as you can go. I mean, I felt like I was an OB, just like you walked in, said hello, made a face, listened to baby, and you walked out. If anyone has been like in the female world of seeing a doctor, like you know what that means. And that's not what I liked, and I knew I couldn't connect with my patients that way. Um, so those were like the first type of models that I had, and I was delivering in the hospital. Now, what the practice I'm at now, I have hour-long appointments with my patients. So I can spend, and I know you have long appointments with your patients too,
Yeah.
like, or your clients. You get more of the story. If I'm walking in and out of there in 10, 15 minutes, I can't get a story or I can't tell you. A lot of people get thrown medication and stuff at them versus like the deep side of it of what you could actually do to change it.
Yeah.
So that's kind of the biggest difference. Also, the biggest difference, and I actually am delivering not at the hospital. My privileges are pending, so I will be able to. But I also deliver at a birth center, which I can go into, like the difference between all of that, which I know we plan
Yeah.
to. So it's definitely a lot more lower risk at the birth center. There's no epidurals. You kind of have to do that natural route. But we prepare these people because we're able to, because we have these longer appointment times
Yeah,
with
absolutely.
them.
Definitely
Yeah.
spend a lot more time, be more personable with people, kind of get to understand
Yes.
them and what they're looking for.
Yes,
Um,
absolutely.
yeah, kind of diving into that, as you said, you get the different levels and stuff, but like kind of give me
Hmm.
that different definition. And you said you're at a birthing center. So I
Hmm.
know that you get out there, you have midwives, you have doulas, you have the doctors and
Hmm.
everything. Kind of give me a
Hmm.
little explanation of either definitions between those and then like
Yeah,
what people
like
would
what they
need to
do.
know. Yeah, if one's recommended over the other and stuff like that.
So layman's term I usually like to give people when they ask what is a midwife because I think it's still becoming a little bit more popular. The more people want that little natural route of things. I usually tell people I'm an OB, I just don't do surgery. So you have your OBs, you have your doctors, they do your surgeries, they still do your deliveries, they could do your OB care, your prenatal care. Your midwife is going to be that next level down. And when I just say down, I don't mean like in regards to like worse, I mean like education level. So like education level, we get to do the deliveries and do all that stuff. We do all your prenatal care. I get to do your like your well woman exams. Certain midwives can scrub in for C-section, which I am one of them that can. And then we get to do the delivery, your postpartum care, all that good stuff. So we get to do everything the OB does. We just have a different mindset. We have a more of a mindset of being there for you and hearing you out. We have that nurse knowledge, we have that nurse mindset. So we're a little bit more, I want to say, caring. Not that doctors don't care, but we're used to being with patients a little bit more. Then your next level down will be a nurse. So like a labor and delivery nurse would be you during like your stay. So they wouldn't be the one doing the delivery. They would just be like your nurse that does like your IV, like they help you through your labor. They totally can. Most of them do for labor and delivery, and that stuff. Like your stay in the hospital, that's what they help. Your next level is your doula. So your doula is somebody that's just an extra when it comes to being pregnant. A doula cannot deliver you. A doula can be a nurse if they go back for like a certificate. What they're doing, they are your support. So if you want to advocate for yourself throughout your pregnancy or like throughout your labor or your delivery, a doula is a really good tool to have. They have made my job a little bit easier sometimes because they do a lot of labor support so that I don't have to. So that's also the nice part about doulas.
So I kind of take that as kind of like they're that coach of the pregnancy, kind of being that side support, letting you know as the midwife, like, hey, this is what, like they had the plan, this is what she was talking about and stuff like that, so that the mom doesn't have to vocalize all that or anything.
And that kind of just goes back to like your OB appointments. They're usually 15, 20 minutes. You don't usually have time to talk about like what you're looking for in your delivery. So with midwives, most of the time, they know what you want, what you're looking for. You know, doctors don't. So a doula is a really good tool for like somebody who is having that hospital delivery, or they know they'd want to try and do it without an epidural, because a doula can help you even at home. They can help you at those beginning early stages too, which is really nice.
Nice. And then kind of you spoke about the doula or midwives being in the hospital setting and everything like that. I know out in the world people talk about midwives being at home and doing home births. What is kind of your professional recommendation on that stuff? I know there's different factors and everything and what you kind of see there.
Yeah. At the end of the day, somebody's going to do what they want to do. Do I recommend a home birth? It's not my favorite, but I've never been in that world. I've done mainly hospital. This job now is my first out of hospital experience, but I know we're very well credentialed in what we do. We have things in standby. We know exactly what to do if something, an emergency does happen, and we know who to call, and we're just down the street from the hospital. So we're right next to a hospital. We have all the professionals that we need in there. Versus at home, you kind of have to weigh in that factor of how far are you from the hospital, if you did need to go, those types of things. So I would say either birth center and hospital versus home is where I would push, depending on what your pregnancy is like. So if you have high blood pressures, diabetes, you're overweight, you have like an underlying condition like that makes your pregnancy a lot higher risk, straight to the hospital. Like I wouldn't even think twice. But if you have a lower risk pregnancy, you're better at that birth center home delivery route, because most pregnancies and deliveries are not supposed to be this big medical procedure. It's supposed to just happen. People have been doing it for years, thousands of years.
Yeah. And I know that's what everyone kind of says, even your friends and stuff like that you've been in the room with them. But it's kind of one of those, it's not all rainbows and unicorns normally. It's a lot of chaos and trauma and everything that's going on. And I think everyone really truly appreciates that you kind of come in and say, hey, this isn't going to be a beautiful setting. It's going to be chaos and everything you think it's going to be. Just throw it out the window and expect the worst and then go from there. And I think that truly.
And I usually tell people, like, having a plan is great. But when it comes to labor and delivery and your pregnancy, a plan is just, it's an option of what we can hope for. It's a hope, but it's not like you're not going to be able to stick to that 100%. And, you know, a lot of these patients, you know, they come at the end of it like, that's not what I wanted, but I still am happy, which is great. Like, that's all I want out of that. But I'm very realistic with my patients. I always have been. I'm like, here's where we're at, and this is not where we're going. So kind of just keeping them on a level ground is what I really try and do.
Yeah, and I think that's what you do a good job with, especially expressing that to your friends, like your very close friends and stuff like that, and telling them like, hey, this is straightforward. This is what you should do.
This is what you're going to figure.
Yeah, and I definitely think it's one of those where you have told your friends too, like, hey, first couple nights in the hospital, don't keep your newborn in the room. Like, definitely enjoy your time while you can, and then let them go.
And not every hospital is like that, though. That's the hard part. And
it's probably different down in the big city, I guess.
Yeah. Well, some hospitals don't. Yeah, they have to stay in the room with the patients, which is okay because you're gonna go home with the kid. But if I usually tell people if you can have that chance to rest, your nurse will bring it back. I cuddled so many babies working night shifts, like it didn't bother me. But I know sometimes people kind of have that thought of like, oh, well, it's like I feel really bad. I'm just like passing my baby off. I'm like, we're not gonna do anything in the nursery. Just know this, they're not gonna do anything, feed your baby anything in the nursery. That's not like what you want. Like they're not going to do anything that's like
Right.
outside of your like
Like
consent.
the baby's just in there to sleep and cry,
Yeah.
basically.
Yep.
Yeah. Uh,
Yep.
what is one thing you should like people should know about like midwives that you haven't already explained already? Kind of saying like, hey, what's the main definition with a midwife versus
um,
like your OB and your doula and stuff like that?
I usually tell people a midwife means with women, like that's what the actual term means. So what our whole point of being there for you is to be there for you. So my point is to take care of you, educate you, do everything I can to prepare you for what's the next step. And the next step being the delivery. And then in the delivery process, taking you to that next step, which is the postpartum process. That next step is, into that. So I usually say, the midwife is going to have a little bit more of a holistic, natural approach. I am somebody who firm believes that if you actually change like your nutrition, like the way you're doing your life, it's going to change the way your pregnancy, your labor, and your postpartum is going to go. I've worked with a lot of different, this is where that hour appointment is important to me because I've worked with a lot of patients where I'm like, okay, I know if I can educate you on making this little bit of a change at it because I know this is what you want and your pregnancy is going to be a lot smoother. But, then you have those patients that don't want it. So you're like, here, because I can prescribe medications. Here's this medication. It's going to help you. Like, here you go. And that's not where I try to go. I try and lead with the let's change this first. Let's try this route first before I give you a medication, which is kind of like the difference between like an OB side of things and a midwife side of things, to be honest.
Yeah, absolutely. So, kind of looking at a midwife, especially, I mean, I don't know the past and stuff like that,
Hmm.
but like starting out early pregnancy, stuff like that, normally going to the doctor. What would be your kind of recommendations if someone's wanting to work with a midwife or if they have to work
Hmm.
with their OB to
Yeah.
talk to a
When
midwife,
to reach out and stuff.
adding a doula into their plan? What does that all look like from what you experienced?
A lot of people pee on a stick and they start to panic because they're like, now what? Like, I don't know what to do. So most OBs, even if it's your midwife, will get you into like your first ultrasound appointment and everything like that at 8 weeks. Um, that's if you've never had any issues with a pregnancy in the past. Um, to find what you want in this is, I usually say go shopping. Like you have a couple weeks to kind of figure out where you want to go. Once you find out you're pregnant, you have a little bit to figure out where you want to go. Really truly sit down and think, what do I want out of my pregnancy and what do I want out of my labor and delivery? Like what process? Everyone goes into it thinking they want more of that natural route. But like, do you want to do it without an epidural, with an epidural? To this day and age, they don't really do straight just C-section unless there's a medical reason for it. So when you get pregnant, the end goal is always going to vaginally deliver. But you have to think about if you want pain meds during that delivery or if you don't. And if you don't, I would recommend looking into a doula and a midwife. Things to look for in a midwife if you are wanting a midwife is I would look into like C-section route. So whatever practice you go to, ask them. If you go to your first visit, ask them like, what is your C-section route? And if it's high or if they don't tell you, run because that means that they're kind of like hiding that. If they know their numbers and they tell you this is what it is, they're a little bit more open and honest. Likely they're a lot better at preventing those C-sections. People hear C-section, they think, oh, it's just easy, a little slit, easy peasy. It's the easy way out. It's not. We go through a lot of layers to get to that baby. So it's still a major abdominal surgery that you have to go through with a C-section. So it's definitely not the easy route, to be honest. In regards to midwife, kind of looking at where they deliver. So, the Unity Point midwives deliver at Methodist West. If you want a little bit more of a, I want to say quieter hospital that's not running around rustling and bustling. if you know you want to deliver out west, okay, look into who delivers there. If you're not sure you want to go to the midwife route, then there's OBs that deliver there, those types of things. So you kind of just have to shop around.
Yeah,
And
absolutely.
friends, I will say, ask your friends, who did they deliver with? People that have delivered before, use your resources.
Yeah, absolutely. What would you say, like time frame wise? So early pregnancy, you just found out, whatever. What would you say they need their team by, like with either the OB, midwife, doula? Should they have their
Um,
team up set up by like a certain time frame, or
Most of the
kind of
time,
adding
you
in?
can you can kind of shop around a little bit. Some places have you consult first. So if it is a midwife or a lower risk facility, in regards to like a birth center or even a home delivery midwife, they might do what's called a consult first to make sure that like your health, everything like that fits in line with what they're doing. Because if you're a little bit higher risk, they're not just gonna like say, okay, you can be our patient. So typically, I tell people, I lost my train of thought there. You can like go to different OBs at the beginning. I would say try to minimize that as much as you can. Reason being is the more places you bop around is the more you're going to lose a lot of your prenatal care. So then it's going to be a lot more confusing for the providers that ended up. By your third trimester, you should have who is going to deliver you. So try to get it down pat. I would say try and narrow it down to two before you even go to your first OB appointment and then go from there.
Yeah, absolutely. I think that's really good. I thought it was a good point to ask. Kind of because a lot of people don't know, and a lot of
Mm-mm.
those new
They
moms
think
and
once they're with
families.
someone, they're stuck. And I'm like,
Yeah,
no, you can leave.
yeah,
You can fire
absolutely.
them.
Yeah. But yeah, kind of looking at it from both sides of us. So looking at the midwifery and chiropractic side, like what is your suggestions there? So your brother's a chiropractor and does rehab care. So say something good, but yeah, kind of give me your thoughts on pregnancies with midwifery and like kind of the chiropractic side with there.
I push all of my patients to see a chiropractor. Okay. So I'm winning the sister points here, but I actually really do recommend a chiropractor for a lot of my pregnant patients. I have a lot of patients that come in talking about headaches galore in pregnancy, and that can come from their hormones. But it could also come from all the pressure you're carrying. And so I'm like, chiropractor, go see it. Like, add this to it and then add a chiropractor. Or every pregnant person who's ever been pregnant before knows you have a lovely sciatic nerve, and that sucker can get pinched very easily in pregnancy with all that lower back weight that's baby is carrying, especially later on in pregnancy. So I always recommend that. Um, I also think chiropractic care is great too to help prepare your body for delivery because aligning that hip and like placement and getting your back and everything aligned. I mean, there's sometimes too that chiropractors can help turn a breech baby to head down. So when the baby's booty is down, we want it head to be down. So I know chiropractors can help with that. So I think I spit out go see a chiropractor like at least 5 times a day.
There you go.
So
Smart.
I win.
Yeah, and especially with pregnancies, I mean, you get those hormones going. You get the hormones that kind of release the ligaments, release the body, kind of loosen the
Yep.
body up, kind of later in that pregnancy. And I mean, that's going through the entire pregnancy.
Yeah,
But
for
I
sure.
mean, that's a big thing with, especially with chiropractic, just making sure we're mobilizing certain joints. But if they need to strengthen in exercises, that's kind of the biggest thing as well, is giving them certain things to kind of help the body accommodate to those later parts. And then like you get into C-sections, and I always say that's a big trauma to the body with that abdominal surgery.
Yeah.
You got to strengthen, but what do you have to do right away as a mom? You're in your pregnancy, you got to be a mom, and you got to go home and you
Hmm.
got to take care of that. So definitely making sure chiropractic rehab, I think that's a very vital thing after pregnancy as well, to make sure that we're
Yeah,
rehabbing
for
back.
sure.
Because I still to this day believe that PT or some sort of rehab needs to be utilized
Hmm.
directly after pregnancies, whether
I
that's
agree.
natural or C-section births. Like I think
Hmm.
it's a major trauma to the
Oh,
body.
definitely both. Yeah.
You're expanding, you're loosening things, your hormones are high, like, and your body has just went through a major trauma for 9 months, and then
Hmm.
you get an even bigger trauma with the pregnancy aspect of it and giving birth. That like, hey, some sort of care with physical therapy or rehab, I think is very vital, and I think that's something
Hmm.
that needs to be pushed.
There's no
Um,
one size fits all when it comes to going to see an OB, midwife slash midwife, chiropractor, and PT. Like they all three do such different things, and I think people don't realize that. I think they think, oh, I'm seeing my OB, like they'll know what to do with like a prolapse, which that's a whole different story. But like no, you're gonna get that care from a PT, and then if you're going to a chiropractor, they can help with that rehab too. So it's like you sometimes have to see all three of them, and that's okay. But
Absolutely.
you sometimes it's not a quick bounce back like everyone thinks.
Yeah, absolutely. And I mean, that's the biggest thing here. Yes, my clinic is more of that rehab chiropractic physiotherapy style,
Mm-hmm.
but we have a great chiropractor doula here in town. And it's one of those like, it gets so far into a pregnancy, I don't have the tables and the accommodations in my clinic to be
Mm-hmm.
able to help out. I am more than gladly to refer to that other chiropractor and kind
Mm-hmm.
of finishing care. So it's not, hey, we're working as a team to kind of really figure out what's best for that
Mm-hmm.
mom and kind of going forward from there. Um,
And you doing that is the same thing like midwives, OBs, doulas, nurses all do together as well. It's all about a collaboration of care. So, and you do that outside of delivery too. So with like chiropractors and PTs and stuff like
yeah,
that, you do, and you have to.
yeah. It's taking care of the body and knowing what the body
Mm-hmm.
knows needs at that moment, and especially with pregnancies. And I think those are a very very traumatic thing, but it's also
Yeah.
a great joy for most parents and
It's
families. And
90% of the time, 90 to 95% of the time, my job is super happy. It's that happy thing, when you want to keep it going into that happy process by having all of the support and everything that you can from a lot of people. And you're going to need that. So, something to add to it, which if you are pregnant and wanting a chiropractor, and like you said, you refer out to that one gal, just make sure they're good or they're knowledgeable in the Webster method because that's what a lot of the pregnancy aspects
yeah,
need to be, which you can
yeah.
talk more on that if you know.
Yeah, absolutely. I mean, I know the Webster technique. I utilize it, but I don't use it as much in the office just because I would say a normal population of my clientele is probably like 2 to 3% are going to be pregnant. I think right now I
Mm-hmm.
have like two or three patients. So it's not like I am consistently seeing pregnancies. Whereas I know Dr. Annie up the street at Rooted, she has probably one every day she sees. So she is very vital in utilizing that technique
Yeah.
every day. So I know how to do it. I know what it feels like. I know how to work that
Mm-hmm.
procedure, but it's also one of those like I don't do it consistently enough where I'd rather
Mm-hmm.
refer to someone else and kind of finishing care that way and utilizing that
Yeah, for
technique.
sure.
Yeah.
Yeah, for sure.
Uh, no, I definitely appreciate jumping on today. I think it's great to kind of really learn about you, even though I know most of the information. But
Thank
learning
you.
how you've come from high school into college into being a nurse, but then also going into your midwifery, it's very impressive on how you've kind of transitioned through all that, but also creating your career and moving it all the way to Arizona,
I
um,
know. It's
which is
insane.
which is frightening for people, and people don't do that stuff.
No.
But how can listeners that are on the podcast really kind of learn more information about midwives, but also learn how to support you and your career as you kind of go along?
I am easily reachable, honestly, anywhere if you want. If you will reach out to I almost said my brother, but Christopher, if you reach out to him, I mean, he is my brother, but if you reach out to him, he can always send you my way if you need to. If not, my Instagram is just straight Kassie Reil, Kassreil. Now, this is my personal Instagram. I do not have like a midwife Instagram or anything like that. It's not something I've ever pushed forward, but I'm always, always, always willing to answer questions. I have many, many people that reach out to me throughout my entire lifespan of things, and I'm always willing to give you a little bit of advice, remembering that I'm not your provider, so I can't give you the exact advice, but I said, if it was me, this is what I would do. Or if you were my
Yeah.
patient. So, something that you could always do. Yeah. Always reach out to me with any sort of questions. You totally can. I'm always willing to talk.
Yeah, absolutely. And we greatly appreciate having you on the podcast. I appreciate it myself.
Thanks for
Um,
having me.
yeah, absolutely. But that is another episode of the Becoming Elite podcast. And I appreciate Kassie Reil being with me.